If you've ever had a tight neck before, then you've been told how to stretch the ever-living crap out of it. Whether that was tilting your head to your shoulder, pulling up on the seat of a chair, combining the two, or hanging your head off the side of your bed to get a deeper stretch. So today, I'm going to tell you why your friends, family members, gym teacher, and maybe even your doctor are wrong. And this is because a lot of the time we ourselves, in addition to our medical professionals, are more concerned with mobility than they are with stability. And the reason why might surprise you. Let me answer this by asking you a stupid question. How do we measure mobility? Well, that's I don't even know how to answer. By how much you move? Awesome. Now, follow-up question. How do we measure stability? Why are you doing this to me? Because joint mobility is something that we can measure, whereas stability isn't quite as straightforward. And why this matters is because since we're so results-oriented, we're looking for something measurable that can show progress over a month. But that progress doesn't necessarily mean that your symptoms are getting any better, or more importantly, that your injury is actually healing. And when it comes to stretching and mobility, it makes a lot of sense when you stop to think about it. If, like most people, this is your first time learning that overstretching can actually further damage your neck, pop down into the description where there is another video that discusses 5 common misconceptions when dealing with a disc herniation or neck injury. There's also another video down there that discusses a timeline so that you have a better idea of how quickly you should be recovering from a cervical disc bulge. Now with that, let's get back into the video. Let's use a bike tire as an example. When we're pedaling, we do want movement, but we want that movement to be forward. Same thing goes for a joint. When a muscle contracts, we want a joint to move in its correct joint motion pattern. But if we don't have enough stability, that joint starts to move around in other directions. This would be the same as not fastening your axle properly, so now your wheel goes left and right instead of just forward and back. And if you've ever done this with a bike or even your cars, you know that's what causes the tires to wear out faster. Now, weird as this is going to sound for a lot of you, your body knows this inherently, and it knows what to do. When there's been a muscle strain or damaged tissue to either the discs, a tendon, a nerve, it guards automatically because it senses things aren't going to move right and aren't working properly. So if you continue to use them, you run the risk of damaging it further. This is called muscle guarding, that tightness that you'll get in your traps or the front of your neck. But you, individually, don't like the discomfort of that tight muscle. So, rather than addressing why that muscle is guarding, we stretch it and override it, getting ourselves maybe 5 minutes of relief, but causing a lot more potential for damage down the road. And ideally, where we want to be on this spectrum is smack dab in the middle, somewhere between stabilized and also mobilized. But whenever you stretch, we come all the way over here into hypermobility, or too much motion, which can wear out the joint and tear the muscle down further. And what your body tries to do to counteract that is overstabilize that joint by tightening up your traps and SCM muscles, which brings us to our first stretch, which you are all probably familiar with, the trap stretch, where you reach behind your back with one arm and then pull your head with the other. And this is usually done to alleviate tension you're feeling along the back of your neck and up into the top of your shoulder. But what we're actually doing is opening up too much mobility, which can then stress ruptured discs or tissues in the bottom of your cervical spine, leading to more damage. So, if that stretch is bad, what the heck are we supposed to do to strengthen it? Our goal then becomes not so much restricting the range of motion that we move our neck through, but rather making sure whatever position we pull our neck into, we're strong enough to be there. So let's get on to the exercise. If you were to stretch your left trap, what you would do is you would tilt your right ear towards your right shoulder, and this would get you a nice stretch on that left side. More than likely, you would grab your head and then pull further towards that right side, getting a deeper stretch, but also running the risk of overstretching that left trap. So, the exercise we're going to do is the exact same stretch position, but lying on your side, actively tilting your right ear towards that right shoulder and holding this position for 30 to 60 seconds, as best as you can. If you need to take a break, that's completely fine. But what you'll notice is not only do we get a slight to moderate stretch on that left trap, but we're also activating the muscles on the right side of your neck and that right upper trap. And we're doing this for two reasons. One, to get the same stretch, but also to strengthen the muscles on the opposite side of the neck so that you keep stability while also increasing mobility. Pretty straightforward, right? But what I love about this exercise, rather than focusing directly on stretching a muscle, is that it limits your ability to hurt yourself, because your body really isn't going to pull another muscle into a stretch that injures it further. Think of it like the bumpers at a bowling alley. Sure, you can still pull your muscle into a stretch, but the odds of you forcing that muscle to contract harder than it's going to hurt on that opposite side are very limited. Versus when you're using another set of muscles to pull into that stretch, it's very easy to further irritate disc bulges, arthritis symptoms, or torn muscles. Plus, we also get the added benefit of strengthening that opposite side of the injury, giving you more stability, but also giving you better mobility. The next stretch that I see a lot of the time then goes to the SCM, where what you do is you would take a hand, reach behind your back, grab it with the other arm, pull, and then you're going to look towards that side, tilt your head back, and look up. And this will stretch the front of your neck, compressing a lot of your discs in the back of your spine, especially in the middle, and putting a lot of stress on that outer side, which may herniate a disc further. Like that trap stretch, what we're going to be doing is pulling our head into the position of stretch. So where we're trying to get that left SCM to stretch in that final position, to do that, what we're going to do is we're going to rest on a bed or the floor. We're going to turn our head to the right. We're going to then tilt our head to the left, and then we're going to lift our head up. And what you'll notice is you still get that stretch on the front of your neck on the left, but you'll also get a contraction of the muscles back here on the right side of your neck. And that'll be your levator scap, your splenius capitis muscles, and also your upper trap that pull you into that stretch, getting more mobility from this tight muscle in the front, but also more stability from these muscles here in the back of your neck. Here's a little bit of a better view for you. So we're going to turn to the right, tilt to the left, and lift up. Don't lift so far that the muscles in your neck start to cramp, but just so we get that gentle stretch in the front of your neck. So basically what you're saying is we can still perform the stretch, but we just need to activate the muscles that pull you into that stretch? Yep. But why does that make it any different? Your muscles talk to each other, front and back, left and right. And what they normally are saying to each other is, I'm firing, you don't fire. Or, I'm not firing, you should fire. Because if we both fire at the same time, nothing moves. But if neither one of us fires, then that joint is just going to slip wherever gravity takes it. And so, when we contract a muscle and pull ourselves into a weak position and hold it, what we are doing is we're telling its opposite muscle, look, I can hold you here. Everything's safe. Nothing hurts. You can relax. Versus whenever we pull ourselves into that position with a different set of muscles, like tilting our head to the side and pulling down on our head, the opposite muscle never gets that signal. It's just getting told, I'm being turned off and overstretched. Hopefully somebody else is holding that joint stable. And when it comes back and no one is holding that joint stable, it freaks out and it tightens up twice as hard. And this is why you normally only feel good for about 5 minutes after you stretch, and then everything comes back hurting twice as much. You're overriding your body's natural defense system, and then when it comes back online, it goes, something's going on where this joint still isn't stable. We'll just double down on what we think works best. But if you've ever done either of these two stretches prior to today, don't feel bad. All of us have. But this third one is where I have a lot of questions because it sort of seems to supersede all of our common sense and is done by a lot of people, despite it looking like a full Nelson from WWE. And this is where we lace our fingers together, reach behind our head, and pull down on our neck so that it stretches down between our shoulder blades all the way up to the base of the skull. Almost like we're just waiting for the rock to come up behind us and pile drive us into the floor. Now, I hope you're paying attention because whereas the other two exercises we're pulling ourselves into a stretch position, this exercise is actually going to be pulling us out of that stretch position, because a lot of the time when people have soreness and aching down in their lower traps between the shoulder blades, it's coming from a position of weakness. So we're going to do a modification to a move called Superman's. So what you're going to do is interlace your fingers like you're getting ready for that full Nelson. You're going to put them on the back of your head and you're going to gently lift. Try not to push down on the back of your head while you do this and extend up. Now, understandably, this is going to be hard for a lot of you. And if you don't mind the static on the microphone from me showing you what it's probably going to look like, you're going to be down here and you're just barely going to be able to lift your elbows off the floor. Make sure when you do this, you're not pushing your head down. And if you are, unlace those fingers, have them right behind the ears, and just come up a little bit. In all seriousness, that move is difficult. I'm even a little sweaty from doing it. So, if it's too hard to perform while you're on your stomach, do it standing. And all that looks like is a tiny bend forward at the hips, hands behind the ears, pull those elbows back, pull the chin back, and try to extend that mid-back as if you're trying to pinch a pencil between your shoulder blades. And with those 3 exercises, ladies and gentlemen, you're not only going to be limiting your ability to hurt yourself from overstretching and causing more soft tissue damage, possibly worsening a disc herniation or bulge, but you're also going to be strengthening these muscles that help support your neck, limiting your risk of arthritis from hypermobility of those joints, and actually addressing the major issue, which isn't that you don't have enough mobility, but it's that you lack stability. And by strengthening those muscles and that neuromuscular connection by holding yourself in place and getting a tiny stretch, you're going to get closer to that balance. And what you'll notice is you won't just have a middle of the road range of motion, you'll actually have more mobility with less pain because your body knows that you're safe. And guys, if this new perspective on active stretching changed your perspective on recovery, please make sure that you share this with a friend who also has neck pain, because realistically, they haven't heard it either, and you can be the smart friend that just blew their mind. Plus, you're also going to help get them out of pain that much faster. And with that, I'm Dr. Beck. I hope this video and this channel helped to get you out of pain and to help you make the most of your one life.